A pleasant day to everyone. We are Group 1 and we are going to discuss about the Leopold's maneuver and the ante-postnatal exercises. And here is the list of our group reporters. We have me, Mr. Willie II M. Alusada. We have Mr. Gerard James V. Chu. We also have Miss Mary N. Gozon. We have Miss Ariane Kisha L. Quijano. And lastly, we have Miss Nicole Uriel P. Tabuco.
So here are the course learning outcomes for our first module. After 2 hours of class reporting and various online class activities, the Level 2 nursing students will be able to define the key terms in Leopold's maneuver and ante-postnatal exercises. This consists of antepartum, antepartum exercise, ballotment, Bartholomew's rule, crowning, engagement, fetal heart tone or rate, finger breadths, fundus and fundal height. Next are the gravida. Under it is the nulligravida, multigravida, and the primigravida. The Leopold's maneuver, lie, which includes longitudinal lie and the transverse lie. Maneuver, para, postpartum, position, presentation, station, and symphysis pubis. Next is to discuss the importance of Leopold's maneuver, antepartal and postpartal exercises, and then to discuss the maneuvers in Leopold, and list and compare antepartal and postpartal exercise, and then explain the principles involved in Leopold's maneuver, ante and postnatal exercises. The sixth CLO is to examine the guidelines in Leopold's maneuver, ante and postnatal exercises, and then to list the nursing responsibilities before, during, and after performing Leopold's maneuver, ante and postnatal exercises, and then to state comfort positions related to antepartal and postpartal exercises, and lastly is to document client responses and outcomes after Leopold's maneuver and ante-postnatal exercises.
Hello everyone, this is Mr. Alosada and I will be handling the definition of terms. First, we have antepartum, which is basically the time period of pregnancy of the mother. Next, we have the antepartum exercises, which are safe and recommended exercises that will benefit and help prepare the mother during labor. Next, we have ballotment, which is using the finger to make a sharp upward push against the uterine wall to diagnose pregnancy by feeling the return impact of the displaced fetus. Now we have Bartholomew's rule, which is used to calculate the fetus's age depending on the height of the fundus. It uses landmarks instead of numerical height values. If the fundus is at the symphysis pubis, then the age of gestation is about 12 weeks. If the fundus is midway between the symphysis pubis and the umbilicus, the age of gestation is about 16 weeks. If the fundus is at the umbilicus, the age of gestation is about 20 weeks. If the fundus is at the xiphoid process, the age of gestation is about 36 weeks. Next, we have crowning, wherein the baby's head starts to emerge little by little during each contraction. Next, we have engagement, which is where the baby's head moves into the mother's pelvis in preparation for birth. Then we have the fetal heart tone rate, which normally ranges from 120 to 160 beats per minute and is measured sonographically, and the normal range depends on the period of gestation. Next, we have the finger breadths, which is the breadth of the finger and is approximately 2 centimeters. Next, we have the fundus, which is the top part of the uterus. Now we have the fundal height, which is the distance in centimeters from the pubic bone to the top of the uterus. The fundal height of a normal growing baby matches the number of weeks of pregnancy. Next is gravida, which is the number of times a woman has been pregnant regardless of the outcome. So, we have nulligravida, a woman who has never been pregnant. And then we have multigravida, a woman who has been pregnant more than one time. Lastly, we have primigravida, which is a woman who is pregnant for the first time or has been pregnant one time. Next, we have Leopold's maneuver, which is used to determine the fetus's position and will be discussed later on. Now we have the lie, which refers to the relationship between the long axis of the fetus with the long axis of the mother. So, we have the longitudinal lie, a situation in which the long axis of the fetus is parallel to that of the mother with either a cephalic or breech presentation. We also have the transverse lie. The fetus is positioned horizontally across the uterus rather than vertically, wherein the baby's back might be positioned down, with the back facing the birth canal, with one shoulder pointing towards the birth canal. Next we have maneuver, which is a careful guide used to achieve something in the end. Next we have para, which means the number of births a woman has made after 20 weeks of gestation. So, we have nullipara, a woman who has never carried a pregnancy beyond 20 weeks. And then we have primipara, a woman who has given birth once beyond 20 weeks. And lastly, we have multipara, a woman who has given birth twice or more beyond 20 weeks. And a reminder, multiples such as twins are considered as one birth. Next we have postpartum, which is the time period just after labor. Now we have position, which refers to which side the fetus is in. For example, is it on the left or is it on the right? Next is the fetal presentation, which refers to which body part is closest to the pelvic inlet of the birth canal. So we have vertex presentation, wherein the top of the head goes first. It is also considered as the normal and most common presentation with the fewest complications. And then we have breech presentation, wherein the buttocks or feet goes first. And then we have shoulder presentation, wherein the arm, shoulder, and trunk go first. We also have compound presentation, wherein any other part together with the fetus head goes first. Next we have the station, which describes how far down the baby's head is in the mother's pelvis. Lastly, we have the symphysis pubis, which is located above the external genitalia and in front of the bladder. It is a secondary cartilaginous joint which is made out of hyaline and fibrocartilage. Let us now proceed to the importance. First, we have the importance of the Leopold's maneuver. It helps us determine the lie and presentation of the fetus. It helps assess the shape of the maternal pelvis. It also assesses whether the delivery is going to be complicated or not, as well as if a cesarean section is necessary or not. Then we have the importance of antepartal exercises. First, it helps strengthen perineal fibers to avoid tearing and lesser complications during labor. It also improves posture and prevents backaches. It decreases fatigue as well as stress. It also helps build stamina and breathing techniques for the mother during labor. Lastly, we have the importance of postpartal exercises. It reduces fatigue and increases vigor. It improves mood states and mental activity as well as physical fitness. It promotes in returning the mother to pre-pregnancy weight. It decreases the risk of developing future chronic health conditions. It also helps provide important mom time and social interactions. That is all, and once again, this is Mr. Alusada. Thank you.
The first maneuver, or the fundal grip,
helps determine whether fetal head or breech is in the part of the uterus that is superior to the entrance of the uterine tubes or the fundus. To assess whether the fetal head is in the fundus, the nurse will be facing the client's head with hands placed in the fundal area and a soft, irregular mass in the upper quadrant of maternal abdomen is expected when palpating. We will know that our findings are normal if we can feel a soft mass that is the fetal buttocks and if the fetal head feels round and hard. The second maneuver, or the umbilical grip, helps locate the back of the fetus. To conduct this assessment, the nurse, by still facing the client, the palms are placed in either side of the abdomen. The sides of the uterus are then palpated. Hold the left hand stationary on the left side of the uterus from the top to bottom, then hold the right hand steady and repeat palpation using the left hand on the left side, or move your hands to the lateral sides of the abdomen. After the assessment procedure, we will then find out if our findings are normal. If on one side of the abdomen, you will palpate round nodules that are the fists and the feet of the fetus. The other side of the abdomen feels smooth, which is the fetus back. Kicking and movement are also expected to be felt and is normal. For the third maneuver, or the Pollux grip, which helps determine the part of the fetus at inlet and its mobility, the first step of the procedure is to move your hands to the lower pelvic area and palpate the area just above the symphysis pubis to determine the presenting part. As seen in the picture in your screens, it is obvious that the thumb and third finger is used to grasp the presenting part. The normal findings for Pollux grip is that an engaged head is The normal findings for Pollux grip is that an engaged head is round, firm, and palatable. Is the fourth maneuver, or the pelvic grip. This maneuver helps determine the fetal attitude and the degree of fetal extension into the pelvis. In this maneuver, instead of facing the client, the healthcare provider will be facing the client's feet. The hands are then placed in the abdomen and the fingers are pointed to the mother's feet. Try to move the hands while applying downward pressure. After the assessment procedures, we will know that our findings are normal if the hands move together easily. The fetal head is not descended into the maternal pelvic inlet. If the hands do not move together, the fetal head is engaged into the pelvic inlet.
Another topic we are about to learn is antepartal and postpartal exercises, or antepartum and postpartum exercises. Why do we need to have these antepartum exercises? Why? Because it may decrease preeclampsia and cesarean delivery. It promotes healthy weight gain during pregnancy, improves your overall general fitness, and strengthens your heart and blood vessels. Pelvic floor exercise. This training will help the body cope with the growing weight of the baby. You can have a healthy and fit muscles before the baby is born, and will mend more easily after the birth and helps you to reduce or avoid stress, incontinence after pregnancy. Back and abdominal exercise. It strengthens your abs when you're expecting support from your pelvic organ as your baby bump gets bigger. Next is ankle exercise, or ankle rotation. This can help with the circulation and may reduce some fluid buildup. Lower limbs relaxation. So this exercise helps open the pelvis and gives the baby room to maneuver as they head towards the birth canal. Breathing exercise. It is very important during pregnancy because it ensures efficient removal of waste products and as well as plentiful supply of oxygen for both the mother and the child. And now, why do we need to have postpartum exercises? Because it helps strengthen and tone your abdominal muscles. It boosts your energy and may help you prevent from postpartum depression. Foot and ankle exercise. So this exercise aids blood circulation and prevents blood clots. Pelvic floor exercise. This exercise can reduce swelling, increase blood flow, and improve healing from giving birth. Pelvic tilting exercise. Your pelvic muscles can tighten and become more painful after childbirth. So this yoga pose can help you relax and gently stretch your muscles to relieve pain. Abdominal breathing. So deep breathing is an exercise where you can begin within the few days of giving birth. Taking a few minutes each day to focus on your breath can help you relax and reduce stress. Head and shoulder raising. So this kind of exercise can help you strengthen and tone your abdominal muscles and will also boost your energy. And lastly, leg raising. So this exercise improves the blood circulation. So what are the difference between antepartal exercise and postpartal exercise? The antenatal exercise aims at preventing lower back pain and enhancing physical and psychological preparation for delivery by means of joint stretching and muscle strengthening. And for postnatal exercise, it strengthens pelvic floor muscles to prevent incontinence, prevents lower back pain, and next is it speeds up restoration of body shape and simulate blood circulation and enhance appetite.
Psychology. We should be mindful in the psychological state of our clients, especially because in this assessment, we are dealing with pregnant patients who should not be exposed to stress, for emotions that a mother can feel is likely to affect the baby. So it is a must for the nurse to keep the client calm by explaining the importance and the reasons for performing the assessment. Gain permission first before proceeding with the assessment. Informing the client ahead of time will also help gain their cooperation throughout the procedures. Also ensure the client that every procedure is needed and is safe, and that palpating her abdomen will not harm her or the fetus to reduce any anxiety that the client might feel. The principle of physics is also involved in this assessment because the nurse should make sure that his or her hands are warm enough before performing Leopold's maneuver to avoid uterine contractions and any discomfort. Pressure should also be controlled when palpating the patient's abdomen. The nurse should make sure that he or she is applying gentle pressure when palpating and should not harshly palpate the maternal abdomen. For the principle of anatomy and physiology, it is really important for the nurse to have a deeper understanding on the parts and functions of the body to properly assess the pregnant client, because in performing Leopold's maneuver, enough knowledge is needed to properly know which part is to be palpated without risking the client. Microbiology is also involved, for it is important to avoid any possibilities of infection and transmission of microorganisms, so it is a must to perform hand hygiene before and after contact with patients. To make this possible, performing medical hand washing prior to performing Leopold's maneuver is a must. Gloves may also be worn in cases of secretions. The principle of privacy is important to keep the client comfortable at all times. As a nurse, it is our responsibility to ensure that the patient is covered properly and the parts that are not needed for the assessment are draped well to provide privacy to our patients. Sociology. Establishing rapport with the client will be made possible by conversing and starting a conversation to help ease their anxiety. Time and energy is also involved because it is a need to utilize our time well. We should make sure that the client would not doubt our skills if we are taking too much of their time. Materials provided like gloves for secretions and towels or cloths for drapings should also be used properly. The principle of safety and security. Identification of any medical problem or previous medical problem is important during high pregnancy because the body undergoes so many physiologic changes, and certain medical conditions can put the mother at high risk for maternal or fetal complications, so it is a must to make sure that the client has already consulted with her physician before proceeding with the assessment and exercises.
A pleasant morning to everyone. I am Mary Faustine Guzon, and I am here to discuss about the different guidelines regarding Leopold's maneuver and antipostnatal exercise and the different nursing responsibilities before, during, and after. Let us proceed to the Leopold's maneuver guidelines. So first thing is, Leopold's maneuver is difficult to perform on obese women. It is particularly challenging to identify the fetal presentation and the fetal lie because the internal structures of obese women are encased in a thick layer of adipose tissue. The palpations can sometimes be uncomfortable or uneasy for the woman if care is not taken to ensure that she is relaxed and adequately positioned. To aid in comfort, the nurse should ensure that the pregnant woman has recently emptied her bladder. So why is it important to let the mother void beforehand? Correct and accurate findings can be obtained if the mother has an empty bladder, and also a full bladder can sometimes obscure a fetal contour. Next is, the client should lie on her back with shoulders raised slightly on a pillow and her knees drawn up a little. So this is what we call the dorsal recumbent position. Her abdomen should be uncovered and the individual performing the maneuver should warm their hands prior to palpation. The examiner should take care to not roughly or excessively disturb the fetus. Let us proceed to the antenatal exercise guidelines. First is, the pregnant woman should start slowly and be careful to not overexert themselves. It is a constant reminder that pregnant women should not overdo it, whether they are exercising, just walking around, or doing housework. It is good to take your time and respond to your body's cues to slow down or stop altogether. Never exercise to the point of breathlessness. This is a sign that the baby and the pregnant woman's body cannot get the oxygen they need. As a normal part of pregnancy, your breathing may be affected by the increase in the hormone progesterone, which causes you to breathe in more deeply. This might make you feel as if you're working harder to get air. When exercising, it is essential to keep it in a moderate manner. The mother's changing weight alters the center of gravity, putting extra strain on the joints and muscles in the lower back and the pelvis increases the chance of losing balance. Next is to take frequent breaks and drink plenty of fluids during exercise. Both are important for the mother and the baby to prevent dehydration, overexertion, fatigue, and stress. And next is to avoid exercising in extremely hot weather. While most women without health problems can safely exercise during pregnancy, doctors discourage workouts in hot weather because it can lead to heat stress and dehydration. Avoid rocky terrain or unstable ground when exercising because ankle sprains and other injuries may occur. Exercise on a flat, level surface. And lastly, include relaxation and stretching before and after exercising. It is to allow the body to relax and rest. The third is the postnatal exercise guidelines. First is to consult with a doctor or midwife before starting any postnatal exercises. It is important to discuss your exercise plans with your doctor or other healthcare provider early on. The level of exercise recommended will depend. It is important to make sure that your muscles have healed before you do any vigorous abdominal exercise. Labor and birth can cause physical problems including back pain and a leaky bladder, both of which can be made worse by vigorous exercise. Your abdominal muscles may have been separated during the pregnancy. They usually go back to normal after the birth, but sometimes they can also stay separated. You will need to do exercises to strengthen these muscles to avoid back pain and injury. Avoid high impact exercise or sports because the ligaments and joints will be loose for at least 3 to 6 months after delivery. Most doctors recommend that pregnant women avoid exercises after the first trimester that require them to lie flat on their backs. Doing high impact exercise can increase the chance or possibility of prolapse. Prolapse is when an organ, such as the uterus, drops down. When pain manifests, slow down or stop completely. Above all, it is essential to always listen to one's own body. If pain is felt, it is better to go on a slower pace or completely end the exercise. Regular exercise will strengthen the pelvis, but be cautious of exercising too vigorously too soon. Even if you're feeling great after having your baby, your body will have gone through big changes and needs time to recover. And that's the end of the different guidelines regarding Leopold's maneuver, antenatal and postnatal exercises. Let us now proceed to the nursing responsibilities before, during, and after. Starting with the before, first thing is to always do medical hand washing. As we all know, hand washing is one of the simplest and best ways in preventing the spread of bacteria and viruses. In doing medical hand washing, it reduces the risk of transmitting infections or any harmful substance to the patient or the mother. Second is to explain the procedure to the mother to reduce anxiety and answer any questions that she may have. From the patient's point of view, knowledge displayed by medical professionals like nurses are foreign to them. Anxiety and stress may arise due to the insufficient understanding of the procedures done to them. It is important and essential to explain the steps of the procedure in words that the patient can easily understand. Third is to instruct the mother to empty her bladder before performing the maneuver, so that she will be comfortable and the contour of the fetus is not obscured. It promotes comfort and allows for a more productive examination. As what was stated earlier, we need to let the mother void in order to obtain the correct findings, since a full bladder can sometimes obscure a fetal contour. Fourth is to place the mother in a dorsal recumbent position. It is supine with knees flexed to relax abdominal muscles. Dorsal recumbent position is where the patient lies on the back with the lower extremities moderately flexed and rotated outward. Fifth is to place a small pillow under the head for comfort. Sixth is to drape the patient or the mother properly to maintain privacy. And lastly is to make sure the hands and the stethoscope are warm before coming in contact with the patient's abdomen. It is because cold hands can stimulate uterine contraction. Let us proceed to the nursing responsibilities during the procedure. So first is, when palpating, use your palms and not the fingers. Palpation means feeling the abdomen with your hands in specific positions or moving them in particular ways using certain levels of pressure. It is helpful in determining how the baby is lying in the uterus and in knowing the fetal position and its fetal presentation. Second is, the nurse should stand with the body facing the patient during the first 3 maneuvers and facing the feet of the patient during the final maneuver. And third is to pay attention to the mother's responses during the process. It is important to observe the responses because it is an important contributor to the quality of care. And lastly, let us proceed to the nursing responsibilities after the procedure. First is to inform the mother of the results from the procedure. Receiving health-related information from their providers favorably affected the mother's trust and confidence to the nurses or medical professionals. Second is to evaluate the mother's reactions. It is to assess or determine whether the mother is experiencing discomfort or pain while conducting the maneuver. Third is to provide health teachings. It ensures that the mother is well informed about her own health and knows her current condition. Fourth is to do aftercare. And lastly is to do documentation. It is significant for good clinical communication. It provides accurate data, the reflection of nursing assessments, care provided, and the patient information to support the healthcare team in delivering great care. And that is all for my report, and thank you for listening.
The different comfort positions related to antepartal and postpartal exercises. The first one is hands and knees position. This position provides relief to the back and boosts oxygen levels for the baby. One problem about it is that the mother may get tired. The sitting position, the mother could do this on a birthing chair or on a toilet. Her legs must be spread so that there could be relief on the pelvis area. Birthing ball position. You can use the birthing ball position in several ways. Some women sit or rock on it and lean against it or simply drape their upper bodies over it while kneeling. This could help the baby move into a more favorable birthing position. This also relieves back pressure. The squatting position. Squatting could be done against the wall or with a support with a partner or a chair. This helps open the pelvis and gives more room for the baby as they head toward the birth canal. Upright position. Always remember that gravity may not be your best friend during pregnancy. You can make it work to your advantage during childbirth through upright labor positions. This also relieves backache and can make contractions less painful and encourage baby to move deeper into the birth canal. The lunging position. Lunging may not sound to be a good idea, but lunging is a good exercise since it helps the baby rotate or descend towards the correct position. This also opens up the pelvis so that the baby could have more room. Squatting. Along with this is that gravity is by your side. When it comes to delivery, this also helps decrease the need for delivery tools such as forceps or vacuum. Reclining. Childbirth is hard work and you might need to take a break. So keep in mind reclining, lying down in a bed or reclining against a wall or a chair or another person. This could release tension and relax muscles. This may be a good alternative if a woman is tired and does not want to do other exercises or comfort positions. The birthing bar position is an attachment that can be added to many labor beds to help support a birthing position. With the birthing bar, you can sit up at any time and squat, lean on the bar for support. One of the good things in this birthing bar positions is that it expands the pelvis and uses gravity to push the baby down. Kneeling birthing positions. If the baby is facing the mom's abdomen instead of her back, kneeling can help them turn into a proper position. Kneeling is one of the most popular birthing positions because it can also give the mom a much needed break. This also relieves pain of contractions and eases back pressure. For the postpartal positions, first is the chin to chest. Lying on her back with no pillow, the woman raises her chin forward without moving. The woman raises her chin forward without moving any other part of her body while exhaling. This should be done 3 or 4 times. Abdominal crunches. This must be done lying flat on the floor, with knees bent, with folded arms across the chest and raised into a sitting position. Abdominal breathing. Lying flat on the floor and breathe slowly and deeply. Document the client's responses outcomes after Leopold's maneuver and antepostal exercises. First, I'll give the acronyms. LMP stands for last menstrual period, or the last time the woman or the mother experiences menstruation. GTPAL, gravida, term, preterm, abortion, and living. AOG, age of gestation. EDC or EDD stands for estimated day of confinement or delivery. So in GTPAL, gravida stands for the number of times the woman has conceived, including the current pregnancy. Term births are the number of times the woman has carried pregnancy at least 37 weeks. Preterm births refer to the number of times a woman has delivered before 37 weeks of gestation, but after 20 weeks. So basically, 20 to 36 weeks of gestation is in line with the preterm births. Abortions is the number of time a woman loses pregnancy, whether in purpose or not. Living or living children, the number of births that are living. So here's an example. Gemma is 37 weeks pregnant. This is her second pregnancy. She delivered a healthy baby boy at 39 weeks with her first pregnancy. What is Gemma's GTPAL? So check the number of times the woman has conceived, including the current pregnancy. So the gravida is 2. For the second, term births, check if the woman has been pregnant and has delivered a normal baby for at least 37 weeks of gestation. So that's 1 because she only delivered 1 baby pa. The one currently ongoing is at 37 weeks, but the baby hasn't been delivered yet. And for the preterm births, it's 0 since Gemma did not deliver any baby within the range of 20 to 36 weeks. The abortion is also at 0 since she did not lose any baby during her pregnancy. And for the last one, L, living, she has 1 living child. So 1 for L. So the answer is G2, T1, P0, A0, L1. And once her second baby is born and is living, her GTPAL becomes G2, T2, P0, A0, L2. Okay, now let's try to solve for the age of gestation. It can be in the weeks or in the months. So let's start with the date of examination or date visited. That's August 23, 2020. The name of the mother is Miss GV. So we're only putting her initials due to confidentiality. Her age is 27 years old. Her GTPAL is G2, T1, P0, A0, L1. Her AOG or age of gestation is 37 weeks based on the UTZ and computation. Her LMP is March 4 or 2020. That's the last menstrual period. And the EDD or the EDC is at December 11, 2020. That's her estimated date of confinement or delivery. And her findings are L1, the fundal height is 27, fundal content is in the buttocks. L2, fetal back, R side means right side, and the mother side. Fetal heart tone is 140 beats per minute, so that's normal. Or LQ, right lower quadrant. Fetal small parts in the left side of the mother. And L3, floating. L4 is cephalic. So let's start to compute for the EDC or Nigel's rule. This is the standard way of computing pregnancy. We have to minus 3 months, add 7 days, and add a year. So for Miss GV, she's 27 years old and her LMP is at 3/04/2020. Therefore, you can see 3/04/2020 in the given. And the standard computation used is 371, as we know. And the EDD, that's what we're trying to compute, is 12/11/20. So in trying to compute for this, since the LMP is already given and the standard computation is also given, which is 3, 7, and 1, we just have to add it. So we'll start from the left side. So 3 minus 3, that wouldn't really work. So you'd have to add a year and you'd cancel out the 1. Since 3 minus 3 doesn't really work, you'd need to add 12 so you could make it like a whole number, like you would want it to be part of the calendar, like 1 to 12. Diba, there's no 0 in the calendar. So that's why we plus 12. For the days, it's just simple math. 4 plus 7, that equals 11. And for the year, 2020 plus 1, and then the 1 gets cancelled because you added 12 to 3. For the AOG, or McDonald's rule, the formula is fundal height in centimeter times 2 over 7. And for the weeks, it's fundal height in cm times 8 over 7. So let's try solving this. Since we know her fundal height is 27 centimeter, let's put that in. So 27, we're trying to solve in months by the way, times 2, so that's 54. Divided by 7, you get 7. And the remainder is 5. And then we get the denominator from 7 also. For the AOG in weeks, it's still the same. 27 times 8, which is 216. Divided by 7, that's 30. And then remainder is 6. So 6 over 7 again, which is the denominator. So 30 weeks and 6 over 7 days. This shouldn't really be done in decimal since it's pretty confusing. So that's why we just use fractions. So for the AOG, the long method, what we need is the LMP, the EDD, and the date of examination. So the first thing we do is the LMP minus the number of days in that month. So for us, it's March 04 minus 31. So that's 27. And for the second thing, which is the date of examination, which is August 23, you can see it at the bottom part. You should write that down. After that, add the months going from March 27 to August 23. Then when you try to compute it, March 27, April 30, May 31, June 30, July 31, the answer would be 172 days. If you want to solve it in weeks, you divide it by 7, and the answer would be 24. But it has a remainder of 4, and then you put the denominator again, which is 7. Next, if you want to get it in months, you divide 24 to the number of weeks in a month. So that's 4, diba? So 24 divided by 4, that's 6 months. There's the answer.